Hi guys, this is Dr. Kevin Parshad with the Limb Plastics Institute in Las Vegas, Nevada, and I'm here with Cosmetic Lane, and we're going to talk about lengthening all things in the body. So limb lengthening is a procedure that has actually been around for a long time. The concept of what we do is called distraction osteogenesis, and that's the process of lengthening bone. It's really been around for probably 70 years, and we usually use it for the application for deformity correction in kids born with congenital deformities, or in pathology, or in traumatic injuries where patients may have a shorter leg or non-union, and so that's the initial application of the type of science and technology. However, as technology has advanced, we started using it a lot more in the cosmetic realm, where we use the same concept to lengthen bone to improve or augment height and stature. Depending on what the patient is trying to achieve or the desire of the patient, the capacity currently of the intramedullary lengthening device is about 8 centimeters, which is approximately 3.2 inches. So in one lengthening procedure, patients can hope to achieve about 3.2 inches. If they want to do more than one, they can get up to 6 inches. In some patients, that may be a potential. So if you were to proceed with one procedure like femoral lengthening, usually we'll stage it. I won't do your upper leg bone and your lower leg bone at the same time. I will generally stage it by about 3 weeks. Probably more ideal than that is for patients to fully recover after the first procedure, and then consider undergoing the second procedure. I think that's probably a better way to do it. But there are some patients who really want to do both, and we'll stage the procedure by about 3 weeks. Patients get up and walk the same day. This current implant I'm holding is the current iteration of the implant, which is the Precise 2.2 nail. This allows for partial weight bearing. But still, in the patients, for instance, I did this Friday, we had 3 cases we did. All patients got up the same day and did a little bit of walking with a walker. We do have a new iteration of this implant coming out that will be fully weight bearing, which will accelerate the rehabilitation, because patients will be able to return back to normal activities much sooner. Generally within, I think, 10 to 14 days with that newer implant, patients probably would be able to return back to most daily activities, but wouldn't be able to do things like running or athletic sports until they're fully healed and consolidated. So if you look at the timeline of this, lengthening of a bone takes about 1 millimeter a day, so it really takes about 25 days to gain 1 inch. To gain the capacity of the nail then is about 80 days, which is about 3.2 inches, and then you need to then consolidate after that. So you're looking at 2.5 months of lengthening, potentially another 2 to 2.5 months of consolidation. Really at that point, which is about 4.5 to 5 months, you can return back to high-level type of activities like running, jogging, that kind of stuff. During that entire component, the lengthening as well as the consolidation phase, depending on the implant you're using, the newest one being the full weight-bearing implant, you would be able to walk and mobilize and do just daily activities of living, like walking around, going to the grocery store, driving a car, that kind of stuff, but you wouldn't be able to do high-level athletic abilities during that time. Depending on the patient, and I've done patients that are fairly athletic, a lot of the patients who probably pursue this type of procedure are generally younger, maybe middle-aged, and they do activities like working out, going to the gym, play certain sports. Most of them, if not all of them, can return back to those sports. What I generally counsel them though is that there may be some potential decrease that's unpredicted with doing this type of procedure, maybe a 10% decrease in their high-level athletic ability. So example I often give is if you can sprint the 100-meter in 12 seconds, and it takes you 13 seconds now to do it, or, a little longer, then that might be the exchange that you have to accept to undergo the procedure and gain that additional height. Cosmetic limb lengthening has been around actually for, before me. It's certainly been around for, decades. And we do have some data long-term that's looked at patients that have undergone the procedure even years and years ago, when we're talking in the 70s and 80s with external frames. And the general consensus is that the patients actually do very well. Looking at things like arthritic and arthritis, because you're dealing with the lower extremities, the entire procedure is extra-articular, meaning that we're not violating the joint to put the implant in, and we're lengthening within that one area, usually in the mid part of the bone. So we don't think that it's going to change much around the biomechanics of the joint, as well as change any loads or variable parameters around the joint that would lead to arthritis. So I don't think those things are probably a risk in what we've seen so far. I think when it comes to the bone itself, once it heals and consolidates, I do think that the bone will return back to its normal strength, then the implant gets removed. I think the one long-term repercussion that is there is really the soft tissues. So once you lengthen those muscles and tendons and muscles and nerves, I do think that you change the lever arm of those tissues forever, and that may impact some of the function of those patients. Not necessarily their daily functions, but I think more their high-level functions, like things like running long distance, I think sprinting. I think if those are key factors for that patient, that's something that needs to be discussed with them. Weight gain is not going to impact the way that this result is. The only part to consider with weight is there are weight limits for the implant. So even with the current implant, our weight limits are between 50 to 75 pounds. The newer implants, they will be closer to 250, maybe 300 pounds per leg. And that usually will kind of envelope most of the patients who are considering this procedure. So that's really where weight kind of plays a role. I think as you lengthen and consolidate and harden the bone, I don't think that weight will add too much overall to the risk to the patient after they've healed. One sort of consideration is that when you do lengthen the bone, it's generally a hypermetabolic state. I would say the majority, if not 99.9% of the patients will actually lose a considerable amount of weight while they're lengthening. The patients will notice that as they're going through the process, but generally will regain that weight as they enter into the consolidation phase. We do get a lot more requests for shortening, and that's decreasing your height. And there are limitations to what we can do pertaining to that, usually somewhere in the 5 to 6 centimeters per segment. Now, if you think about shortening, for instance, the femur by 2.5 inches, then you are actually shortening the lever arm of those muscles, and hence you may affect the way that they function. Generally, patients can be a little bit weak initially because they don't have the same capacity to fire those muscles. Then they slowly shorten the muscles with time, and they tighten up, and that allows for that return to function to those areas, to return back to higher level activities. So there is a limit even with shortening. Most patients think that that number could be infinite because you just have to take away the bone, and that is true. I can take away a lot of bone to shorten as much as I wanted to, but there are repercussions on the soft tissue envelope around the bone that will have repercussions on that patient and how they function. When it comes to lengthening, there are limitations as well, and those are better understood as the patient going through the lengthening procedure. Most patients, I think, can certainly achieve the femur the full capacity of the nail, which is about 3.2 inches, but it requires diligent work on the patient's behalf. It requires doing range of motion activities and physical therapy during the lengthening process for that 2.5 months, in addition to during the consolidation phase. You're looking at doing it for a good 4 to 5 months before you really realize the benefit of your height, as well as return back to your high level activities. I think as gruesome as it sounds, and I think when people kind of imagine breaking a bone in the body or separating a bone in the body, putting an implant in and slowly distracting it out, it certainly sounds like a gruesome endeavor. But to be honest, our patients walk the same day after doing this procedure. They are up walking. They are usually off pain medication by about 2 weeks. I really think it's no different than my plastic surgery colleagues who do procedures that, have very similar types of recovery in some ways. Having said that, it is longer in some ways where I think there's more time involved and there's more demands on the patient, meaning that I think in routine cosmetic procedures, you just have to heal from them. This is a very unique procedure in it really requires compliance on the patient's and more effort on the patient's part than on my part. I can do the surgery and do everything just right. I need that patient to then put 110% effort into the procedure to make sure that result is going to be perfect. And I think that should not be kind of understated. And I think it's very unique in that relative to other cosmetic procedures where you do the procedure, you heal, there's really not a lot of commitment, I think, from the patient's perspective. I think this procedure is very different, where requiring months of commitment on the patient's perspective to do the hard work to make those gains. And I think that difference alone separates an excellent result from a good result in some ways. So that's really important. I think I've said this before, but I think it's the most gratifying procedure that I do. I think patients are highly content with the results of it. I think it's very impactful. I think in what it hopes to achieve for that patient in building more self-confidence or adding that extra chip to their shoulder. I do think that it really does that. I really feel that patients are very content with it. I think they may regret things like the amount of time dedication that goes towards it. I think there are patients that then when they're going through the process kind of don't fully appreciate, I think, how much time commitment is needed before they would return back to that normal state. And sometimes it can be half a year, right, to make this transformation, which is still a considerable amount of time if you have a full-time job, other responsibilities like family and friends and that kind of stuff. So I think that would be one of the areas where I think patients feel a little bit of that as they're going through it. But I think when it comes to the actual cosmetic result and the transformation, I would say that all patients are fairly happy with that result. A lot of patients ask about that. I mean, a lot of patients ask about just proportions in general. So, we did a survey back in 2018 with patients who just underwent thigh bone lengthening, which is femur lengthening. And I asked them and I said, what do you think about your proportions? Because I get this question a lot from patients who are in the pre-consultation phase or the consultation phase about proportions after you've undergone this transformation. And, my anticipation was that patients were going to say that they were neutral, meaning that they were neither, negative or positive towards that change. What was surprising is I actually found that patients actually reported a slight enhancement in the way that they looked. So the answer that I got often was, I actually prefer my proportions after the procedure. So there are some patients that while they're going through the process of femur and tibial lengthening, they want their wingspan to match their lower extremities, and you can undergo arm lengthening as well. Generally, we perform that in the humerus. Generally, 2 inches is about the maximum because of the way the implant works. But yes, it has been done, and there's some patients who decide to pursue that. So we do have a lot of transgender patients. Proud to help them and serve that population. I do think that I do think it helps those patients really kind of feel comfortable in their skin in some ways. I mean, there are patients who want to get taller because they more identify potentially from a female going to a male and identify with that additional stature with more masculine features. I do think that it's certainly something I see much more. I think it's a growing trend in patients who are looking to transition and really kind of fit the characteristics that are particular to that specific gender. So, I think that it requires some conversation with the patients about, their motivations, why they're doing it. Oftentimes they may be speaking to counselors already, so I'll often speak to them just to go through what the process entails so they have a good, full appreciation of what we can achieve, what we can do. I do think that height plays some role in societal norms in some ways. I do think height, not that it should be, but I do think that it does play some role in how patients are perceived. I mean, even the classic description of a male is tall, dark, and handsome. The first characteristic of that is tall. I mean, so there's certainly this idea of even, height and being tall and this concept of stature with this perception of masculinity. So I do think that, even though it shouldn't be, I do think that height is a characteristic that there is some bias against in society. And I do think that, patients and people perceive that. I mean, particularly when looking at a couple, people going into the boardroom. I think they had a statistic looking at US presidents. I think every US president has been over 6 foot, which is unusual because that's not the average height. They use a classic statistic of the Fortune 500 CEOs. I think their average height's like 6'1.5", which also is not in fitting with the average American person or average American male. So I do think that there is certainly some bias when it comes to height and the way that they are perceived in society. So that's just my perspective. I've actually been, there've been a few celebrities that have contacted us before, so I won't name those people, but for instance, I was invited to Kevin Hart's comedy show. He did not contact me in the sense of for the procedure, and so it was here in Las Vegas, and I think he was filming it for Netflix, and he, obviously, people know what I do, and so he opens with a 4-minute bit about the procedure, and obviously making fun of it, but he does mention some of the articles that were sent to him of me and some of my patients, and posing and that sort of stuff, and obviously he's classically known for being a shorter person. So it was interesting, but I do think that certainly the pop culture has picked up this procedure, and I think there's some interest in it. And there's no particular celebrity that I'd want to operate on necessarily, but if they need my services, then I'm happy to help.